Hi, and welcome to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back.
Welcome back. We see poison ivy all the time in the Northeast where I practice, and I think this would be a good time to recap what you can do as parents at home to manage your child's poison ivy.
Okay, let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
So when I tell people that I live in San Antonio, in South Texas, I almost always will hear, how can you stand the heat? And yes, we do have to contend with the heat during the summer. I will certainly agree with that. But there are many pros. And one of the ones is I have in my mind a list of things that I do not take care of as much in South Texas as a pediatrician as I did in the Northeast. And on my list are Lyme disease, because we don't have that level of tick presence like you do in the Northeast, seasonal affective disorder, because we have sun throughout the year, and poison ivy. Mm-hmm. And I don't want to claim that we don't have poison ivy here. We do, but we know poison ivy, poison sumac, poison oak, all of these grow best in humid environments. So for the same reason that the Northeast has these gorgeous, huge trees, it has a higher density of poison ivy than I do here in a slightly drier area and hotter area of the country.
Yeah, where we live right now, poison ivy is everywhere. Mm-hmm. If you go on a hike, it is creeping into the trails. Like you brush by it almost inevitably when you do a hike right now in the woods. So it is something that we see quite a bit where I practice.
Yeah, I have vivid memories of getting poison ivy every year as a kid growing up. And my most vivid one is I was with a friend at her house and we were climbing a tree in her backyard. I was so reactive to poison ivy, I would start itching very quickly after exposure. And sure enough, I went home later that day and broke out. And I remember being bedridden because I had it all over the inside of my legs. I had it on the inside of my arms, and I even had it on my stomach where my shirt had come up from climbing the tree. It was terrible. It was so bad. So I have these like visceral memories of how itchy and painful and just, it's just so irritating.
Not everyone is actually sensitive to poison ivy.
Yeah, this is true. Yeah.
So like I am very, very sensitive to poison ivy as well. And I remember numerous times as a kid getting the itchy rash, but my husband is actually not sensitive to poison ivy.
Oh, so he can't give you sympathy on this?
No, but he can take care of all the poison ivy in our backyard.
Oh, that's a good
So whenever I see it, I will send him, I've seen poison ivy here, and here, and you need to go get it.
That's perfect.
So why don't we just start off by talking about poison ivy? Sometimes I see it in the office where I see the rash and people don't know that they have poison ivy.
Oh, right? Sure. Yeah. Absolutely.
Like they have this terrible rash. They don't know where it's come from. That's sometimes how it presents in the office.
Yeah.
So poison ivy is caused by a plant called poison ivy. There are other, as you mentioned in the intro, there are other plants that also do this, that grow in the Northeast, poison sumac and poison oak. Mm-hmm. And I always encourage people to get on Google and look at photos of what this looks like.
Yeah, the leaves of 3, let them be.
Exactly.
Right? That's mantra you learn as a child.
That's the mantra, right. Mm-hmm. And also in your story, the vine that sometimes creeps up the tree can be this like hairy, thick, brownish, blackish, vine that goes up that has no leaves. So you don't know that it's poison ivy, but you could also get the poison ivy reaction from the root as the ivy is climbing up a large oak tree or something too.
Yeah. And it's the oil, we know it's the oil on these leaves that can get on the skin and then causes a reaction. And like many, many rashes, the reaction starts as a red area that can be itchy and irritating and even a little bit swollen. It can be in linear streaks, like in lines. It could also be in like round patches. And then it can go on to develop a blistering.
And this type of allergy that people have to poison ivy oil is actually different than some of the classical seasonal allergies that we think of.
Yeah, this is a good point.
It sparks the immune system, has a delayed type sensitivity reaction to the oil, where even initially you don't realize that it's on you. For you, you are very sensitive. So sometimes in a matter of hours, you may know that you were exposed. But for some people, it can be 48, sometimes even 72 hours from the exposure to the of the plant to the point where you're actually starting to have the rash, which then makes the diagnosis hard. It's been 2-3 days since you were out in the woods or playing outside. You don't make that association anymore with the rash. So that's important to know when you're thinking, is this poison ivy? It can be 2 or 3 days later that the rash appears.
The medical term for this type of rash is contact dermatitis. Dermatitis just meaning inflammation at the skin, and contact meaning something touched the skin that caused the skin to react.
Right.
So there are also times where a parent appropriately comes in. The rash can look terrible, right? I remember it looking terrible as a kid. I've seen it in patients. It can look terrible. They do not know what caused it. Of course, they want to come in and know what this rash is. And we can offer a lot of reassurance of this is just the skin reacting to something that touched the skin. But even with the best of history, sometimes we aren't sure.
Right.
You know, this looks like it could be poison ivy, but you can get a contact dermatitis from a number of different things that can touch the skin, right?
And like you mentioned, you know, the history helps, knowing that they were in the woods, climbing a tree or something like that in the last few days. The other thing is that linear pattern. You can imagine if you're walking on a trail and the poison ivy leaf brushes against you as you go by, and it kind of, you know, hits your skin, it'll leave like a linear trail of where the oil touched you. And then that can sometimes be an indicator, oh, I think this is poison ivy based on how it looks on the skin.
And with any contact dermatitis, as doctors, we're always looking at the distribution, meaning where is it on the skin? So if areas that were covered by clothing, if that area is completely clear, but the skin exposed on the outside is where you see the rash, then we can know this is a contact dermatitis, because other types of rashes, like viruses, like a viral example, don't spare the parts of the body that are clothed.
Right. There is an added caveat and a mystery that sometimes gets associated with poison ivy, and that's related to the fact that it's the oils that cause the contact dermatitis. The oils is what you're allergic to. And some people who react a day or two after they've been exposed to the oils, the degree at which you react to it is related to how long the oil is in contact with your skin. So if you know that you've touched poison ivy by accident, and you run inside immediately and soapy hot water, wash that oil right off, the chances that it'll develop into a bad reaction is much less than if the oil sits on your skin for a day or two. So you can imagine that if you have a 2-day lag between when you were exposed to the oil and you just happen to not wash as completely in that interim, the oil is sitting on your skin for 2 days before you even notice the rash, and then the reaction can be more severe. So I think it's good to keep in mind, in general, those people that are sensitive to poison ivy, every time they go outside or come back from an outdoor adventure, take a warm, if not hottish, soapy cleanse of the skin, shower, bath, or whatever you do, however old your child is, to wash any oils off your skin. That is a preventative measure that you can take.
Yeah. You know, I can think of those times, even here, where my kids might be playing out in the woods around our house,
right?
The brush. And every once in a while, they'll just, whatever it is, they'll come into contact with something where as soon as they come inside, they're like, I just feel itchy. And my first reaction is always, go take a shower.
Right.
You know, it could have been a number of things that caused that, but go just wash whatever is on your skin off so we can prevent this more serious reaction of whatever is sitting there.
Right. And sometimes my advice when people really struggle, I mean, they come to the doctor with poison ivy, I instruct them, when you're washing the oils off, the water is hottish, right? Like it's not just a cold bath. Water helps rinse oils away. And when they use soap, which also breaks up oils, they literally like soap, like every
Sudsy.
inch
Mhm.
of your skin,
Yeah.
because any part that you missed and the oil is still there, you're at risk. So you sometimes have to be a little bit OCD about
Mhm.
how you get every inch of your body soaped and washed down. And so that being said, sometimes the oil is the cause of a mystery. So let's imagine this story where you've been exposed to poison ivy. It's on your skin somewhere. You don't adequately wash off the oil because you don't know that you've been exposed, and you go to sleep that night, right? So the oil actually can get on the sheets from where it was on your skin, and then it touched your skin overnight. And then the next day you get into the bed, and the small areas of little spots of oil on the sheets as you get into the bed again touch different parts in your body. So now it kind of looks like the poison ivy is contagious, where the first day you get this big patch, but the next day you're getting small little patches every day of poison ivy, and you think it's spreading, although you haven't been outside in the interim. So sometimes this is the presentation where we see where someone thinks they're having an evolving contagious like rash, where it's actually just the oils being present on most likely the bedding. Sometimes it's the couch or clothes. It's kind of spreading, not as bad as the initial exposure, but little spots everywhere. So I make people mindful of that, the way that poison ivy is transmitted, so they can know that, oh, now that I'm getting all these little spots, I need to do my bedding.
Wash the bedding, wash
Yes.
the clothing. This is sounding very reminiscent of head lice, although it's not nearly as pervasive as head lice.
Right.
So this is a much easier challenge.
I do also recommend, the hottish cycle with plenty of laundry detergent, because the soap and the hot will help clean the oils off of your bedding. The final mystery that sometimes it's hard to solve, why does my child keep getting poison ivy? They're not even outside. It sometimes can be the family pet, where if you have like an electric fence that encompasses some sort of poison ivy in your yard, and your dog is out there getting the oils on their fur, and then on your couch, wrestling with you on the floor or on the carpet, those oils can be sometimes transmitted through a pet. And then, of course, the dog needs a hot soapy bath as well.
Right? Yeah, which is why this may be one of the only examples in pediatrics where one of the measures that we instruct people to do is to go inspect your yard. Go inspect your yard and get rid of the poison ivy that you see.
I do want to dispel a myth where, if someone has had poison ivy, it starts sometimes by an itchy rash. And sometimes when it's a severe reaction, it can sometimes ooze like a clear fluid. Mm-hmm. And when that clear fluid like dries up, it can have kind of almost like a crust that looks amber or yellow that can sometimes be mistaken for an impetigo, even like a bacterial skin infection, but it's just all poison ivy. And some people feel the oozy fluid from the lesion is contagious to give you poison ivy elsewhere. And that is not true. Mm-hmm. Now, if you've never washed off the original oil from the original spot, and it starts oozing and spreading the oil because it hasn't been washed off, then you can imagine the ooze being contagious, but only in that one scenario, because it's actually the original oil that's spread.
There is that initial, when you're just starting to react, you're not even quite sure what that is. And you can imagine kids, especially, they're itching and then they're touching everywhere on their body. Like that you can spread the oil that way, that early on phase.
Or people don't adequately scrub, every inch of their body, or it's itching, so they don't actually really
it's
the hot water and wipe it with the soap. So you have to be hyper vigilant about getting rid of the oil.
Yeah.
One of the funny things that sometimes I see with poison ivy, like the initial exposure, like you said, is usually on the arms and legs, the part that's not covered by clothing. But after the oil starts getting spread, you scratch before you wash the oil off, a lot of boys will develop lesions in their groin area.
That is so true.
Isn't it?
Yes.
So, when you're looking and evaluating your child and putting on the creams or the treatment and doing the wash down, just make sure that we're checking there too as parents.
Yeah, that's a good one. When people are questioning why is it spreading, there is this factor that rashes evolve over time and different parts of the skin can react more quickly than others. So it's normal to see a progression and some change over a few days of time. So I think let's turn our attention now to things that you can do at home to mitigate the itchiness, to treat it, so to speak.
Right. All right. So not all poison ivy needs to be brought into the pediatrician's office.
Yeah.
This is something that can be managed at home with over the counters. And first and foremost, like we mentioned in the first half, the washing of the oils, both away from your skin with hot soapy water and from any bedding or clothing that maybe has gotten in contact with the oil. So that's something that can be initially done at home.
Yeah, the at-home remedies, the over-the-counter remedies are really to help reduce the itching as much as possible, because that's what's so irritating. So I'm looking at the healthychildren.org, the AAP site, and they recommend calamine lotion 3 or 4 times a day that you just dab on the spots for the rash, and then you just let it sit there, and that can help. Hydrocortisone cream is very good as an anti-pruritic and anti-itch cream for anything that is causing itching on the skin, like bug bites, but also in this scenario with a contact dermatitis from a poison ivy.
And I think the hydrocortisone, the steroid, may also help break up that delayed type hypersensitivity immune reaction that's happening to the poison ivy oil itself. So it may help lessen the severity of poison ivy if put on earlier.
And that can be put on twice a day, again, dabbing it on the spots where you need it. Any type of cool water. So cool compresses, cool showers, cool baths, really anything like that that helps with the soothing. These are the things that you can do at home to sort of kind of get through this period.
Yeah. But sometimes when poison ivy is very widespread, there's a lot, like in your case, all over your abdomen, legs, and arms.
Yeah.
It can be quite miserable. And there are things that the pediatrician can prescribe to help if you have a more severe case.
Yeah. I think we should discuss the reasons why you would go to the doctor for it. So certainly we talked about it being widespread, which, by the way, I did not go to the doctor for that.
So
but I was fine. I was fine.
You don't have to go to the doctor.
No, you don't.
Right?
Like we know this is self-limited. That's a term we use in medicine. That means that it does go away on its own.
Right.
So there's nothing that your doctor is going to do that's going to treat it to take it away, right?
It just mitigates the itchiness and the symptoms and maybe make it a little bit less in severity, right?
Yes. So I think reasons to go to a pediatrician are certainly if you see it anywhere near the eyes or mouth, right? Somewhere on the face, and also near the genital region as well. There's areas where we just need to be more careful to make sure the reaction isn't causing other problems, and there might be medications that a pediatrician would prescribe in those situations to decrease the inflammation.
Like sometimes when I see lesions on the face, it can actually lead to swelling, even around the eye and all over the eye. It can look very, very swollen and red as a reaction to having face poison ivy. And sometimes when I do see that as a pediatrician, I not only give stronger topical medicine, but also an oral medication to counteract that.
I think another reason to go to the doctor is with anything that results in a lot of itching in the skin, particularly in kids, there's a risk of breaking the skin open, which always causes a risk for introducing bacteria into that site and infection. And if you can imagine you have skin that's red and swollen and sometimes crusting and oozing like you described, it can be really difficult to discern, is this actually infection or is this just still the reaction to the poison ivy? And that's a really important time to go to your doctor to have them take a look at it to determine that. Does this need an antibiotic? Most of the time it does not.
Right.
But depending on the location and severity and the crusting and the amount of breakage of the skin from the itching, there are times that is necessary.
Yeah, and sometimes a tip at home that makes you think infection rather than just severe poison ivy is the presence of fever.
Yes.
You don't always need to have a fever for a super infection or infection on top of a break in the skin. But if there is a fever, then you pretty much, I would recommend going into the pediatrician because poison ivy in of itself does not cause fever.
Absolutely. Even with that severe reaction, widespread, like I described, no fever, right? This was not infection. This was reaction, a dermatitis.
No, that's
isolated.
That's a good point.
And then, of course, Google photos. Make sure you know what poison ivy looks like and how to recognize it, particularly in your yard, and then teach your kids.
Yeah, absolutely. No, poison ivy seems so simple, but can be totally miserable.
Oh, miserable. I have such vivid memories of laying in bed feeling miserable from poison ivy.
Well, hopefully you and your family can avoid poison ivy. And if you do come in contact with it, this episode will help you know how to begin to treat and when to see your doctor if you need to.
Yeah, sounds good. This is 10 Kids, 2 Docs. I'm Dr. Vivian Carlin.
And I'm Dr. Sylvia Bank. We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.